We all encounter cataracts on a daily basis. They're a mainstay of eye care today, and it's estimated that over 20 million Americans that are over the age of 40 are affected by cataracts, and this number is estimated to increase to over 29 million by the year 2020. We know that cataracts are progressive, and for our patients who are not affected by them, we want to slow the progression as much as we can. And for these patients, it's important for us to recommend that they stop smoking, consider supplements, and increase the use of UV blocking sunwear. But for our patients who do have cataracts and that they are affecting their vision, it's time for us to begin the process of cataract surgery. There are three main areas that need to be considered prior to surgery. Number one is the refractive component, and we'll spend more time on this in our next episode, Clinical Insights 12. Also, evaluation of the lids and lashes, and evaluation of the ocular surface. First, let's touch on the lids and the lashes. We see blepharitis in one way or another in most of our patients. Most of us probably don't treat or recommend aggressive treatment in patients with mild cases. But for patients who are pre-cataract surgery, we need to treat these patients. According to studies, blepharitis is thought to be the primary risk factor for endophthalmitis, and it is the number one reason for cancellation of cataract surgery. We suggest that anyone who is considering surgery start using lid scrubs several weeks prior to surgery, and if they have active blepharitis, they should be treated with the appropriate treatments prior to surgery being scheduled. Next, let's review the ocular surface. In a multi-stage study, more than half of all patients undergoing cataract surgery were found to have significant dry eye disease based on objective testings. This is definitely worth addressing because a good ocular surface prior to surgery will aid in the visual and inflammatory outcomes following surgery. As it stands, every patient that undergoes cataract surgery will have inflammation, but we aim to reduce dry eye inflammation as much as possible prior to surgery. We do this in three ways. First, we aim to boost the ocular surface for the patient with mild cases with a good artificial tear that they can use throughout their surgical journey. Next, with the use of cyclosporin BID. We have colleagues who work at surgery centers, and when asked when it's the right time to put a patient on cyclosporin preoperatively, they answer now. One study looked at the use of cyclosporin for 1 month prior to surgery and for 2 months following surgery. The study group had reduced dry eye signs and improved visual quality after multifocal IOL implantation. And finally, for patients with significant inflammation, we will place them on a steroid. We then monitor their inflammation and attempt to treat the underlying cause prior to the surgery. If the management of the inflammation is a further challenge, we'll discuss this with the co-managing practitioner at the surgery center and decide on the next course of action. Cataract surgery is a milestone in our patients' lives, and if we want to improve their quality of life through surgery, we want to address their lids, lashes, and the ocular surface.